3:30.
Good morning. It's a rainy Tuesday morning, and we're reaching you live from Niger Health Radio, your wellness companion. This is the Health Convo show, as usual, where we talk about health issues. My name is Ogo, and I am not alone. I am here with Dr. Olatoun Adeola. Hello, Dr. Tung. How are you?
I'm good. Good morning.
Good morning. Dr. Adeola is a medical doctor, a public health intervention specialist. She's currently the head prevention care and quality improvement services of Equitable Health Access Initiative. Now, on the Health Convo show, we'll be talking about breast health. That's the topic for today. Breast health. We chose this topic because all through the month of October is Breast Cancer Awareness Month, an annual campaign to raise awareness about the impact of breast cancer. So we have decided to show our support here on Niger Health Radio by discussing about breast health. I'm sure we're going to learn a lot on this show, so please don't touch that dial. Listen attentively as Dr. Adeola will be telling us a whole lot about all we need to know. And this is for both male and female because, of course, we all have breast. Dr. Adeola, what is breast health?
It's good you mentioned earlier that this is for both male and female. So breast health is just both the male and the female, men and women, boys and girls, being having a sense of awareness about their breast, what is normal and what is abnormal, being conscious that it's an organ in the body and that needs to be given attention, and there's need to identify what is normal so that when there is something abnormal, you'll be able to detect it early.
Okay.
Yeah.
Interesting. So how does breast affect both genders?
Okay, but, of course, you know, when we talk breast, most people just think of the female.
Yes.
I remember the only breast cancer case I've ever seen in a man. I was in medical school, and it was just one. So it's very rare, and that was when it really struck me that, oh, men really have breasts. Okay, so men and females have breasts, and the structures are identical both for the male and the female. The difference is that the male breast tissue lacks those lobules that makes the breast of the woman more prominent than that of a man. Yeah, so the lobules that the women have, the men don't have it.
Okay.
And it's those lobules that actually help in the production of breast milk. And we know that men do not need to produce breast milk because they do not breastfeed babies. Yeah, so that's actually the difference. So we have a more conspicuous breast in females than in males. Although in some males they have more of those fat lobules, and their breast may become more prominent and unexpected. There's some hormonal conditions that could also make the male breast more prominent than in normal males. Yeah.
So as you were talking about the male breast being more prominent, like the female breast, I remember a video I saw on social media. A man had that kind of breast, and he had a baby beside him. So the baby stood up. He had to push, the baby as in, what do you think you're doing? But you won't blame the baby. I mean, it looked like a mommy's breast.
Yeah, your parents too. So why not just give it to me?
That's interesting. So what are the lifestyle practices that could affect breast health? I said earlier on, it's the breast cancer awareness month in October, and a lot of I don't know if I should use the word a lot of, or some women or some people come down with breast cancer when they go for screening, and some are not even aware that they have the breast cancer. So what are those lifestyle practices that could really affect the breast health?
So there are some practices that affects our health generally, and you would expect that they would also affect the breast as well, because the breast is just part of
The body.
Yeah. And so I would start with the simple ones. Diet. Okay, so what you eat is very important. Meals that are high in fruits and vegetables. Although science has not been able to show a link between what you eat and increased risk of breast cancer, unlike in some other cancers in the body. But yes, a healthy diet will make for a healthy breast, just like for healthy parts of the body. Also, maintaining a good weight is very important. So women who are overweight or obese would have as high as between 30 to 60% higher chances of breast cancer than those who are lean. So you may need to shed some weight if you are overweight. Exercise is very important. Regular exercise could limit the risk of breast cancer by as much as 20%, between 10 to 20%. So exercise. So for everything you do that limits the risk of cancer, you are limiting your risk. You take off another 10% here, another 10% here, the risk just becomes lower. Limiting alcohol too. Just like I said, the breast is an organ in the body, and alcohol has been shown to affect many organs in the body, adversely, and the same effect it has on the breast. So limiting alcohol, because it could increase breast cancer in women by as much as 7%. Yeah. So women should reduce the quantity of alcohol they consume per day. Also, there are some menopause hormone therapy that would put women at more risk of breast cancer. Usually, some women, when they reach menopause, some people don't like the symptoms they're experiencing. Some symptoms are really bad, and make women to seek for menopause hormonal therapy. And those hormones could actually put women at risk of breast cancer. It's advised that for such women, you could take a low dose or take for a very short period of time, and then you stop. Radiation exposure. And people get exposed to radiation for different reasons, maybe by virtue of their work, maybe taking care of family members who need to take radiation for one ailment or the other, or women who have been exposed to radiation for some other health conditions could also be at risk of breast cancer. Lastly, I would say that breastfeeding lowers the risk of breast cancer. So if you're a young woman planning to have a baby in the future, or you're a mother to be, please plan to breastfeed your baby, because it has been shown that women who breastfeed their babies for at least a total of 2 years, maybe for one baby and another baby, a total of 2 years, it actually lowers the risk of breast infection in them.
So I don't know how true this is. When you talked about the last point, you did mention about breastfeeding. So some people say that when a woman's breast is sucked frequently, reduces now this is aside breastfeeding, it reduces the chances of the woman getting down with breast cancer. How true is that?
So the studies that were done in women that were breastfeeding babies.
Okay.
Not women whose breasts are being sucked frequently for other purposes. So I think the postulation must have come as an inference from breastfeeding. I'm not too sure it goes the same way. But breastfeeding, not breast sucking, breastfeeding, feeding a baby.
You've heard it. It's breastfeeding, not
reduces the risk of breast cancer. Yeah.
So are there symptoms for an unhealthy breast?
Yeah, there are many things that which is why when we're talking about breast health, we talked about being aware of your breast. There are things that women could see that could be a red flag, of something being wrong with the breast. So when the abnormal discharge from the breast,
Okay.
yeah, it could be a symptom, and the discharge could, for example, contain blood, or it could be watery. Yeah, you may need to check your breast.
Okay.
Yeah, get a medical checkup.
Mm-hmm.
What are the other things? When the breast becomes unusually bigger, unusually bigger breast, or when there are some changes in the skin of the breast. Okay, there's this orange peel appearance they talk about in the breast. It could also be a signal. And there is pain. And many women experience pain in the breast for different reasons. For example, during your cycle, your period, there could be pain, you know. So, but I mean, pain, and then swelling or abnormal swelling to the breast, yes, could also signal. And then when there is a dimple on the breast, yeah, and a dimple in the breast could also. And then when there is a breast that was not inverted, a nipple that wasn't inverted, that becomes inverted, it could also signal something. And then of course, when there is a wound, a boil, you don't know what it is until you get to the hospital. Don't say, oh, it's just a boil. Until you get to the hospital and you get examined by professionals, then you'll be able to say, oh, it's just a boil or something. So these are some of the symptoms of a breast problem. And then the best thing to do is just get to the hospital and get checked.
And these symptoms, are they both for the male and female? Yeah,
for the male and for the female. They're very rare in males. Yeah, very, very extremely rare in males. But they go for both.
All right. We'll be going on a short musical break. When we return, we'll continue our conversation on breast health, even as we celebrate breast cancer awareness in the month of October. We'll be having Asha with So Beautiful. Enjoy.
Beautiful is your name. Wonderful is what you are to me. It's you I see in my dreams every day, and I pray for you, queen of my life. You are so beautiful, mama, so beautiful. Emi wa mama kan, kalo yeah. Mama mi ò rojú rí. That is why I'm loving you. Nítorí ó ti yà ilé ọkọ. Mama mi ò rojú rí. That is why I'm loving you. La 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 la. Oh, you're beautiful. Oh, you're beautiful. Oh yeah, la 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 la. Oh, you're beautiful. Oh, you're beautiful. Ẹ bá mi kíra fún màmá mi. Òrìṣà bí ìyá o, kò sí láyé. Ẹ bá mi kíra fún màmá mi. Òrìṣà bí ìyá o, kò sí láyé. Oh yeah, la 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 la. Oh, you're beautiful. Oh yeah, la 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 la. Oh, you're beautiful. Whoa, woman, there is no one like you. Oh.
Welcome back to the show. You're still listening to the Health Convo show on Nigeria Health Radio. That was so beautiful by Asha. My name is Ogo, and I am still here with Dr. Olatoun Adeola. Before we went on a short musical break, we were talking about health, breast health. You know, I did mention earlier on that the month of October is the breast cancer awareness month. So that is why we have decided to talk about this topic, and it affects everybody, both male and female, because we all have breasts. Now, Dr. Adeola, what are the common problems with breast problems? You know, what causes breast problems? You talked a lot about that, so we want to know.
Yeah. So when people hear breast, the first thing that comes is breast cancer. But there are many other breast problems. Between noticing a change in your breast and the cancer, there are so many other things that could have happened in between. And you know, many times when women come to me and they say, I noticed something in their breast, you can already see the fear. And they're thinking that
Breast
it's
cancer.
a breast cancer.
True.
Most times they are not breast cancers because there are so many other things that could happen to the breast. Some of them are not problems, they are just conditions. So we could have swellings, could have lumpiness or pain, we call it tenderness in the breast. And it could be due to change in hormone, especially during our menstrual cycle, just like I mentioned.
Yes.
Just before the period, you could have pain in the breast, you could have tenderness, swelling. There are also breast cysts that could occur when fluids are trapped in the breast tissue, and those fluids will need to be managed. We won't be talking about how to manage breast conditions so that people won't go and start treating themselves. But suffice to say that there could be breast cysts and they are not cancers. That could also be what we call fibroadenomas. Now, they are harmless lumps of the glands and fibrous tissues of the breast. They feel firm and rubbery. It may be difficult for the woman to know whether, oh, this is not a cancer or a cancer.
Okay.
But it's usually smooth in texture. They're common between women 20 to 40 years old. And they're usually painless. They could become painful and they could just be removed, and that's the end of such fibroadenomas. There could also be hardened tissues, especially maybe post-trauma. Maybe a woman was involved in an accident or something, and then as part of recovery, you know, sometimes when we recover in other parts of the body, we have this tissue, these hard tissues that form scars. They could also happen in the breast. Also, when silicone is injected into some breast for some cosmetic purposes, it could also create lumps in the breast. There could be nipple discharge, and it could come from many reasons. You should be worried when they are blood stained, watery, or when it comes from just one breast. So sometimes when a breast is sucked frequently, there could be some nip discharge, milk production, even in women that are not pregnant or breastfeeding. So that could happen. There could be sores, cracks, or itchy nipples that can be treated using common over-the-counter medications. Also inverted nipple, like I mentioned. It could be normal for some women. Some women were actually born with an inverted nipple. Many of them are discovered when they go for antenatal clinic, when they are pregnant. So inverted nipple could be normal in some women, and it could come along the line later. There could be extra nipples. Some women have more than one nipple on a breast. Usually they are removed for cosmetic purposes, when the woman doesn't like the look of two nipples on a breast. Yeah, someone is just squeezing her face.
Yeah, I saw that.
Yeah. And then there could be breast and nipple infections. Like I mentioned earlier on, it's just best to get to a physician who is going to tell you this is just an infection. Most of them are treated with antibiotics and they resolve. So these are some of the common breast conditions. Like I mentioned, breast cancer, yes, well, it's not so common, but it could also happen in women, especially in older women.
Wow, that's a lot of length. Okay, so you've talked about now the problems that could lead to breast issues. Now we want to know the routine practices that could help in examining breast condition.
Okay, routine practices. So for those who are less than 40 years old, it is said that if there is no family history or no genetic traits of breast cancer, there may not be a need for routine breast examination, because sometimes women have over diagnosis of cancers that do not exist, has happened in many women because of they are always touching their breast and examining. Okay, but for women that are above 40 years of age, so there are different schools of thought. Some would say you don't need to be examining, or some would say every month, 1 week before your period, after your period rather, you should do a self-breast examination. Should be done at the same time of the month. There are steps in self-breast examination that you could read up because of our time. And then also mammogram is another radiological investigation that could be used to routinely examine the breast. It is advised that women that are less than 40 years shouldn't do a mammogram because it may not be so helpful, because the breast tissues in women less than 40 years is so much, so it may not pick anything, and there may be a lot of false positive results. So in fact, some schools of thought will say that until a woman is over 50, you don't need to be doing routine mammogram, but usually it's advised that after 40 years a woman could have a mammogram. Once the density of the breast begins to reduce, the fast density begins to reduce, then the chances of getting a good a positive from a mammogram increases. So these are some of the routine practices that could help with breast awareness and perhaps checking of the breast.
Right. That's really a lot.
And then for women that have a family history of breast cancer in the family, there may be a need for annual clinical, or once in 3 years annual clinical breast examination. Yeah. Apart from the one you do at home now, you go to the hospital
for
and have a
that.
physician do a breast exam.
I wish we could go on and on and on, but we are pressed for time, and we really learned a lot on today's episode of Health Convo, and where we talked about breast health. Dr. Adeola has told us a lot about all we need to know about our breast. In case you just joined us, don't worry, you haven't missed a lot. You can just go to a YouTube channel that is Naija Health Radio, NAIJA Health Radio. Subscribe and you will enjoy lots and lots of content that we have uploaded for you to take care of your health. My name is Tilogo, and as I sign out with Dr. Adeola, what last word would you like to say to our listeners?
Yeah, just know your breast, and take care of your breast.
Thank you so much for being on the show, Dr. Adeola. I've had an interesting moment with you as usual. Take care of yourself, guys, and continue to listen to Naija Health Radio. Enjoy the rest of your day. Bye-bye.
Bye.